And let's get more from Capitol Hill. We have the third-ranking Republican lawmaker in the House. Congressman Mike Pence of Indiana is also the chairman of the House Republican Conference, and he joins us today on the program. Okay, Congressman Pence, let me first get your reaction on what's going on with the Democrats and how they want to push through this bill.
Well, I think it's got to be a frustration to millions of Americans and expatriates around the world to see the clear majority of the American people rejecting this government takeover of health care, and yet the administration and Democrats here on Capitol Hill continue, as we say back home in Indiana, by hook or by crook, to drag this legislation across the line. I think it is, I think the American people are offended by the massive tax increases, the mandates, the bureaucracy. But as you suggested, Susan, I think they're every bit as offended by the fact that Democrats are actually planning to pass the Senate bill in the House of Representatives without voting on it. Republicans have made two efforts today to give the American people an up or down vote on the Senate bill on the floor. Democrats are continuing to resist those efforts. But, if an up or down vote is good enough for the Democrats in the Senate, I think it's good enough for the American people, for the Democrats in the House, too.
Yeah, Congressman Pence, let me just ask you, because Nancy Pelosi said, why should the Democrats be criticized for using this pass and deem technique? Because Republicans, when they owned the House and the Senate, they did the same thing hundreds of times, in her view.
Yeah, I don't know about hundreds of times. I know there was one occasion that I'm aware of where twice Republicans deemed an increase in the debt ceiling. And frankly, Susan, I think we were wrong to do that. Raising the debt ceiling is a significant issue for this and future generations of Americans. We should have brought it to the floor. But in my nearly 10 years in Congress, I know of no other instance where a bill was not considered at some point on the floor of the House and the floor of the Senate. And the very idea that they would use this deeming procedure for the most significant legislation, transformational legislation on health care in 4 decades, as you said, I think is really unconscionable. And I believe that, that Republicans misused it by using it to raise the debt limit before. But I think it's just breathtaking to Americans to think they're going to pass this massive government takeover of health care without taking a vote in that building across the street.
Okay, so what happens, Congressman Pence, if this vote does pass on this weekend? What do you think, what steps can you take as part of the Republican Party to amend this?
Well, let me say we're going to continue in this fight, and Susan, I'll just tell you, I've been ducking that question for about a week. I'm going to keep right on ducking it. They don't have the votes across the street. I think the American people are rising up as never before in opposition to this government takeover of health care, and I believe we can turn this back. It is a piece of legislation of such magnitude, and it's being passed through by twisting the rules of the House and Senate into a pretzel, and with backroom deals, we're finding out more of those seemingly by the hour. I think, I think we can stop this bill, and we really don't have to talk about what we'll do if it becomes law, because I don't think it ever will.
Okay, well, Congressman Pence, let's talk about the health care reform itself. It just seems that Republicans keep saying no, no, no to this deal. Is there anything that can be agreed upon? I mean, surely even Republicans must understand that there must be some sort of health care reform for the United States.
Yeah, I believe there's an overwhelming agreement, Susan, that we need to have health care reform that lowers the cost of health insurance without growing the size of government. And Republicans, as the president acknowledged when he visited our Republican retreat in Baltimore and then again at the Blair House retreat, the president acknowledged we've been offering legislation over the last year, allow Americans to purchase health insurance across state lines. It has bipartisan support. We could put reasonable caps on malpractice cases. That has bipartisan support. We could use the savings to cover people with pre-existing conditions. Those are all ideas that once we scrap this massive government takeover Democrats are trying to ram through the Congress by whatever means possible, we scrap that, we can move on to some of these bipartisan issues. And Republicans are going to work on the day after we vote this bill down. My pledge to my colleagues is every Democrat that helped us do it, we're going to sit down with them and craft some legislation that'll focus on lowering the cost of health insurance, because it's an urgent need in the country. We need to do it, but we can do it without exploding the role of the government in our health care economy.
Congressman, thank you so much for your time today. That's Mike Pence of Indiana joining us there on Capitol Hill.